Organ donor criteria for heart transplantation allografts have recently been expanded in many centers across the United States, but the results of these changes have not yet been thoroughly studied. The authors of this study searched the Organ Procurement and Transplantation Network database for adult heart transplants that took place across the country from 2011 to 2022. Expanded donor criteria were defined using a previously validated scoring system. The centers where the transplants took place were categorized based on total procedures performed, with those in the top tertile classified as high-volume centers. Among the 5,017 expanded criteria transplants identified, 72% were performed at high-volume centers. The 1, 3, and 5-year survival rates post-transplantation for patients who underwent expanded criteria heart transplantation were higher in the high-volume centers than in the low-volume centers. The ratio of transplants using expanded criteria was calculated for high-volume centers to classify them as low use, medium use, or high use. Survival of patients who underwent expanded criteria transplantations was equivalent across the 3 strata of high-volume centers. But there is an increasing trend in 5-year patient survival over time when the data were categorized by 3-year transplantation eras. These trends seem to be independent of the use of expanded donor criteria, as the survival for all patients undergoing heart transplant was similar across the 3 strata of high-volume centers. In summary, the use of expanded donor criteria in the right clinical settings does not negatively impact patient survival outcomes.